The Secret Life of Teeth. This is a series we've designed to help you unlearn all you thought you knew about your teeth. This is Lauren Hubele here, and I'm here with my all-time favorite dentist, Ana Sanduta. 3 years ago, I met Ana, and I was so astonished by the depth of wisdom and knowledge that Ana possessed about how the body heals, and that in relationship to our caring for our teeth. So, Ana, I have a very important question for you today for our podcast. I grew up, and my children grew up with the belief that there was this tooth that we call the wisdom tooth or a molar that if we had it, we needed to have it removed. And it was something that was just a rite of passage, part of growing up. You would have this tooth removed. And in our discussions, I've come to learn that that might not be necessary. So, can you explain to me and our listeners a little bit about those teeth?
Hello, Lauren. It's my pleasure to be with you again and with our listeners. Of course, you have described an impacted molar or an impacted wisdom tooth. But I think we need to understand more about these teeth. What is an impacted tooth? An impacted tooth is a tooth that for some reasons has been blocked from emerging or from breaking through the gum. Most of the human teeth that are impacted are these wisdom teeth or third molars, especially on the lower jaw. But regularly, these third molars we find at the back of our mouth, and there, because they don't have enough space or room to develop itself or to emerge, they remain under the gum or in the bone.
Okay.
Most of people have 4 wisdom teeth, but there are many cases when we have 1 or 2 or 3 or 4, even 4 third molars missing.
Right.
I am one of these cases. My left upper molar was missing, and I was very happy because I had to do only 3 surgical removals. What makes this condition so frequent? What are the causes? Because the literature, in the literature we find, let's say, 3 topics. One topic speaks about gradually evolutionary reduction of our human facial bones. We as human beings, we are staying more and more in the mind and less in the body. We will have the man of the future will have big skull, big brain, and little middle and lower face.
Okay.
So we can easily imagine that with so reduced dimension of our maxilla and mandible, we will not have enough space for the last teeth that will erupt. And the last teeth that are erupting is canine after 12, and wisdom teeth after 18, 17, 18. Other cause could be our modern diet that is too soft to offer enough force for mastication to grow our bones. And also artificial feeding for babies could sustain the reduction and the posterior position of the lower jaw. We can have fully impacted molars or partially impacted molars that has started the breaking through the gum but didn't succeed. I have some images to share with you. Let's see. Please tell me, Lauren, do you see well the image? Okay. These are the positions that we find the third molars. The first one is a vertical one, then mesioangular, then horizontal, distoangular, that is somehow inclined posterior, buccolingual, that has, you see, has the apexes through the tongue, pointed to the tongue, and
right.
masticatory and chewing surface pointing to cheeks.
Okay.
And yes, and we can have also inverted molars. You can easily see in the last images. Usually, upper molars don't give us many complications, but the lower molars are frequently associated with different types of associated pathologies. And the most frequent is I don't know if you know the name pericoronitis. You can easily see here we have a partially erupted, partially impacted wisdom tooth,
Right.
and around the tooth we have red, inflamed, maybe bleeding gum, pains, frequently severe, mild ear ache, swelling, frequently swelling under the jaw or around the jaw, unpleasant taste, or bad breath. Other pathology are dental cavities involving either the chewing surfaces at the third molar, as you see right here, and dental cavities on the distal surface of the second molar crown. Sometimes, if the molar is lower impacted, we have root resorption here on the distal root of the second molar. Sometimes they develop, as you can see here, they develop tumors or cysts around it. And later crowding on the incisal area. in my experience, I've noticed that they are not necessarily later crowding. I've noticed crowding on the incisors, lower incisors area, in the developmental stages of the molars, even in the bone. So, what to do? What is the
Yes.
management of these situations? It depends. The treatment depends on the presenting complaint, on the history of the patient, on a clinical evaluation, physical evaluation, and radiographic assessment, let's say. Because all the time we need an X-ray. We cannot say remove your third molars without an X-ray.
Of course.
And what to do? For me, if we have the first situation, a vertical molar, a vertical impacted molar with no history of pains, no history of complications, I could choose long-term observation with X-ray assessment every 2 years, maybe. And if I see on the X-ray some hypertrophic tissues, clinical, if I clinically see hypertrophic tissues or sclerotic bones, we can adopt a surgical exposure.
So, Anna, I'm going to ask you to back up on those few terms you just gave. So,
Yes.
you give those in another way. Can you explain that? If you see what's happening to the bone or what's happening to the tissue.
We examine the tissue and the bone too.
Right.
If I have enough space, if I have enough space in the mouth, in the back of the mouth, and I see a hypertrophic gum.
So what is a hypertrophic gum, Anna?
It's a gum, very thick, a thick gum that cannot
Okay.
be that the molar cannot break through it, or
Okay.
um, um, an aspect of a whitish bone, a sclerotic bone, that also cannot be breaked by the molar. We need to make a surgical exposure, not pulling out the teeth, but only expose it. But if I have all other situations, this or this or this or this, we have to be very attentive and somehow think, may take this possibility of surgical removal, because sooner or later these kind of situations will have some complications. Also, you already know me. Beside classical therapeutical methods, I would carefully look inside and do my inner work. Where are my roots? But where are my roots in my earth? Do I feel connected with my ancestors? Do I feel their support? Where are my arms? Do I feel with my arms the root of the sky? Because a human being is is a unity between earth and sky. That's why I consider the third molars like wisdom teeth. They are a symbol for human being. All of us are full of wisdom, but we need to be connected with the earth and also with the sky. If I have a perception, if I have a wrong perception uh, for this unity, I won't have I will have some complications for second image, for example, because I
That's
saw
not real clear. Help me understand that a little bit better, Anna. If I
uh,
have some complications,
because in the second let's say we have the second image.
okay,
We have a case with the second image, and a regular dentist could say, go and pull out your molar, because you will have decays, you will have root resorption, you will have pericoronitis. But I can stay like this if I clearly understand why this molar is in this position. And this is my inner work. It is not the dentist work.
okay,
And
okay, that's clear.
yes, and I have to know what to work with. That's why I spoke about how I understand the wisdom of a human being.
And
Then,
from,
yes,
well, Anna, my understanding from hearing you give other talks are the wisdom teeth are our connections with our ancestors. Am I right?
yes, with our ancestors from the seventh generation back.
Okay, okay.
That's
And
why I consider they are our roots.
right, right. And so for our listeners, because this is maybe well beyond anyone's comprehension, is what does that work look like? And I think that I would like to interject that one type of work that's very powerful in connecting with our ancestors and our roots and our family is family constellation work. And this is, would you agree?
Yes, but I can work by myself. I can work by myself. If I am, I was somehow, I did some shamanic work, for example. I can, I can make my own method of working with my feelings, with my sensations, with my connections. But a good start could be family constellations.
Sure, because most of our listeners might lack some of these tools. And so I think having a framework of if I want to do this work and I don't want to have this surgery, where might I begin? And absolutely, we can do this work on our own, but we might need a guide to get us started.
For sure, if somebody haven't done that kind of work, of inner work, it's impossible to begin by itself.
Of course, of course. So tell us about this crazy picture here with our canine teeth.
The canine, I love them because they are expression of our higher of ourself, of our willpower, of our personality, of our higher self. Um, Here, um, the most impacted canines are upper canines. That's why picked up this image. And it's the same. They don't have enough room to come back in the mouth. But here we cannot leave them there, because the teeth, the milk canine will be lost, and we will have aesthetic difficulties. So we need to do something. And with a radiographic assessment, we can easily discover this canine. The treatment is with surgical exposure, and then we don't have other options than orthodontic device to help and to guide the canine into the mouth. There are no other options. Okay, when we didn't have fixed orthodoncy, it was very difficult, and many canines were pulled out. But now, with the braces and all the technique, it is easy to guide them into the mouth. And here, regularly, I have a child, let's say after 12 or 13. And this child, it's in a very sensitive period of his life. And maybe he needs some guidance. When I would look what is happening with this child in the family, what is happening with him. Does he feel his power or not? I would work like this beside orthodontic treatment.
Wow. Wow. Beautiful, Anna. So my takeaway from this is when possible, we try to save the tooth. Is that what you're saying?
All the time. When it's
All
possible, we'll save the tooth.
And while we make every attempt to save the tooth, there will come times that we might have to remove it if it's causing uh, inflammation or pain or,
Decays,
right,
or
right,
tumors, or
right.
yes.
Exactly. But that by carefully monitoring it, we might be able to preserve it for as long as possible.
Exactly.
Yeah, thus keeping the shape in our mouth and our teeth in alignment. Right. Okay.
Yes. But
Anna, that was
my opinion is that with an attentive observation and with a proper inner feelings, we can save them. Not in all situations, but most of them can work like this. Do you feel the same?
yes, and I certainly can see the benefits of this, and like all body parts, they're all there for a purpose, and we
Yes.
try to do everything we can to keep them because they're part of a system. And once we remove them, then the body has to begin compensating.
And if somebody have necessarily do an surgical removal, I my friendly advice is to keep the molar, not to throw it away. To ask the surgeon, please give me my molars.
I
and
like that.
and we will honor them and we will keep them nearby. Okay, they are not in our bones anymore, but they are a part of me. They are a part of our body.
Beautiful. Ana, thank you so much. Do you have anything else you'd like to add for our listeners?
No, I think I've already told you all I intended.
Okay, very good. Thank you so much.
Thank you, Lauren.